What are the references you should use if you are preparing for the AMC Clinical exam? I'll tell you about the 5 references that you should go through. The first one is AMC Clinical Handbook. This will give you an idea about how each task should be approached and what AIMS expects from you. Especially, they will tell you how the role players are instructed and what your role in each case is and how you will be evaluated by the examiner. The second one is LifeCify. This is a collection of the recalls of the last few years, and it will give you an idea about what kind of topics are asked in AIMS exam, how those topics should be approached, what should be the structure of your history, and what knowledge you need to answer those questions. Thirdly, go through the standard reference materials. For example, the RCH website or the HAGP articles or the NP Medicine White Journal articles. They'll give you some ideas about the AMC references you should go through or how the student clinical guidelines are used for different cases and what kind of knowledge are expected in the student context. Then fourth one is prepare your own notes. These notes will come handy when you'll start preparing for your exam in the final stage, and it's always easier to go through your own note rather than going through all the reference materials all over again. And finally, make sure that you make some flashcards in Anki. When I was preparing, I used Anki to push the short-term knowledge into long-term, and I prepared a lot of flashcards, each focusing on one aspect of the tasks asked in the AIMS exam. For example, taking history or investigations and so on. So these are my 5 highly recommended references or the resource materials that you should be using. If you have any questions about them, please let me know in the comments. Thank you.